Have you ever thought about how a pill meant to help you might actually speed up the risk of a serious stroke? If you are over 50, this is something you will want to hear. Today, we will look at how 7 common medications, often taken by older adults, can increase the risk of a rapid stroke. Before we begin, please take a moment to write your age and location in the comments so we can learn about our audience. Also, if you find this video helpful, please like the video and subscribe to the channel. It makes a real difference and helps others find this important information. Stroke is a major threat as we get older. Studies show that older adults face higher risks of both ischemic and hemorrhagic strokes. Many of us rely on medications every day, but sometimes medications can carry hidden dangers, especially when they affect blood flow, blood pressure, clotting, or interact with one another. In fact, research reveals that older adults taking multiple medications with harmful cardiovascular effects can see their risk of stroke or other major cardiovascular events double or even triple. In this first part, we'll set the stage. Why the elderly are vulnerable, how medications may accelerate stroke risk, and then we'll start with the first few medications types. Stay with me. Why older adults are more vulnerable to medication-triggered stroke. As we age, our bodies change. Blood vessels become less flexible. The brain's resilience to damage drops. Blood pressure regulation becomes more delicate. All these mean that a medication which might be safe at younger age could become riskier after 50 or 60. According to a review in the journal Stroke Prevention in Older Adults, Recent Advances, older adults need to be treated carefully for cholesterol and vascular disease because their risk of stroke is higher. Another key point, older adults often take multiple medications. A major study found that taking 2 or more medications that carry cardiovascular risk leads to a significantly higher rate of major adverse cardiovascular events, MACE, which includes strokes. Here are actionable takeaways. Always review your medication list with a doctor or pharmacist. More pills equals more risk of dangerous interactions. Know that age itself is a risk modifier. Medications that thin blood, raise or lower pressure, or affect clotting may behave differently in older bodies. Understand that a medication doesn't act alone. The environment, blood vessel health, blood pressure, other diseases like diabetes matters. By recognizing your vulnerability, you can take steps to protect yourself. How medications can trigger a rapid stroke risk. Let's break down how this happens. When a medication contributes to stroke risk, it usually does so via one or more of these mechanisms. Increasing blood pressure or causing rapid pressure swings. When arteries are stiff, common in older age, a rise in pressure can cause vessel damage or trigger a clot or bleed. Promoting clot formation or blocking normal clot breakdown. Some drugs change the balance of clotting and bleeding. That can lead to ischemic stroke, blockage. Thinning vessels or raising bleeding risk. Older vessels are more fragile. Medications that increase bleeding risk may cause a hemorrhagic stroke. Drug-drug interactions. Many older adults combine medications. Some combinations magnify stroke risks, especially when cardiovascular effects overlap. Modifying heart rhythm or function. Some medications affect heart rhythm or pump function. If blood flow becomes irregular, clots may form and travel to the brain. For example, the review, Use of Prescription Medications with Cardiovascular Adverse Effects, found that older adults using multiple medications with cardiovascular side effects had about double or triple the risk of stroke or heart attack compared to those who didn't. It's clear, the combination of aging bodies plus multiple medications plus cardiovascular vulnerabilities equals a higher chance of sudden stroke from a drug that may look harmless. Medication. Type 1 non-steroidal anti-inflammatory drugs, NSAIDs. Many of us pick up NSAIDs like ibuprofen, naproxen, or others for pain relief. They seem harmless. But for older adults, they carry a hidden vascular risk. For instance, it's well documented that NSAIDs, other than low-dose aspirin, raise the risk of stroke or heart attack. Here are key points. NSAIDs can raise blood pressure and blunt the effect of beneficial antihypertensive medications. They may promote clot formation or damage blood vessels when used long-term. Older adults with hypertension, kidney disease, or prior cardiovascular events are at higher risk when using NSAIDs. What you can do: before taking an NSAID, talk with your doctor if you have high blood pressure, kidney problems, or have had a previous stroke. Use the lowest effective dose for the shortest possible time. Consider alternative pain relief methods, ice, physical therapy, acetaminophen, when appropriate, after consulting your doctor, because reducing pain is important, but reducing stroke risk is even more important. Medication type 2, antidepressants, SRIs and SNRIs. Depression is common as we age, and antidepressants, especially SSRIs, selective serotonin, reuptake inhibitors, and SNRIs, serotonin norepinephrine reuptake inhibitors, are among the most prescribed medications for older adults. But recent evidence shows that these drugs can slightly increase the risk of both ischemic and hemorrhagic strokes, particularly in people with other health issues. According to a Harvard Health Publishing review, SSRIs, such as sertraline, Zoloft, fluoxetine, Prozac, and citalopram, Celexa, can affect platelet function and thin the blood, which may raise bleeding risks in the brain, especially when combined with blood thinners or NSAIDs. A British Medical Journal study, BMJ 2023, followed over 200,000 older adults and found that recent use of SSRIs was linked to a 40% higher risk of intracranial bleeding compared to non-users, particularly during the first few weeks of treatment. Why this happens: SSRIs and SNRIs reduce serotonin uptake by platelets, weakening their ability to form normal clots. They can also interact with antihypertensive or anticoagulant drugs, compounding stroke risk. Older adults with thin, fragile vessels are more susceptible to bleeding. Protective tips: if you're on antidepressants, don't stop abruptly. Always consult your doctor first. Regularly check your blood pressure and report any dizziness, headaches, or visual changes immediately. Avoid combining SSRIs or SNRIs with other drugs that increase bleeding risk unless specifically managed by your physician. Depression treatment is vital for well-being, but the balance between mental health and physical safety needs careful monitoring. Medication type 3, hormone replacement therapy, HRT. For many postmenopausal women, hormone therapy offers relief from hot flashes, bone loss, and mood changes. But large-scale studies, including the Women's Health Initiative, WHI, revealed that hormone replacement therapy can increase the risk of stroke, especially in women over 60. According to the Mayo Clinic and National Institutes of Health, NIH, estrogen alone, or combined with progestin, can increase both clotting tendency and inflammation in blood vessels, leading to higher stroke risk. Key findings: women taking combined estrogen-progestin therapy had a 30 to 40% higher risk of ischemic stroke. Transdermal patch forms may carry slightly lower risk than oral tablets. Risk rises sharply with age and duration of use. If you're using HRT, ask your doctor if non-hormonal alternatives could work for your symptoms. If therapy is needed, use the lowest effective dose for the shortest duration. Regularly monitor blood pressure and cholesterol. Dr. Joanne Manson of Harvard Medical School explains, for women starting hormone therapy in their 50s, short-term use for symptom relief may be relatively safe, but continuing it into the 60s or 70s substantially raises stroke risk. So if you're still using or considering hormone therapy after 60, have a detailed discussion with your healthcare provider about safer options. Medication type 4, antipsychotic drugs, typical and atypical. Antipsychotic medications are sometimes prescribed to older adults for agitation, sleep disturbances, or behavioral symptoms of dementia. But here's what most people don't know. These drugs can drastically increase stroke and sudden death risk in older adults. A Lancet Neurology review reported that both first-generation, like haloperidol, and newer atypical antipsychotics, like risperidone, olanzapine, quetiapine, double the risk of stroke within the first few weeks of use in dementia patients. Why? They alter dopamine and serotonin pathways that also affect blood vessel tone. They can cause dehydration, hypotension, or blood pressure spikes, each a trigger for vascular stress. Some cause metabolic side effects like high cholesterol or elevated blood sugar, further increasing stroke risk. Practical advice. These drugs should never be used for mild behavioral problems in dementia unless absolutely necessary. If prescribed, doses should be minimal and monitored closely by a physician. Family members should watch for sudden confusion, slurred speech, or imbalance, signs of a possible stroke. The FDA even issued a black box warning about the increased mortality risk in elderly patients with dementia using antipsychotics. This risk isn't theoretical. It's real, and it happens more often than most realize. Medication. Type 5 decongestants and cold medications, pseudoephedrine, phenylephrine. Many people over 50 still grab over-the-counter cold and flu remedies without thinking twice. But here's what few realize. Decongestants like pseudoephedrine and phenylephrine can sharply raise blood pressure and trigger stroke, especially in older adults with hypertension, diabetes, or heart disease. According to the Mayo Clinic and Cleveland Clinic, these medications constrict blood vessels to clear nasal passages. But that same constriction affects arteries throughout the body, increasing the risk of stroke or heart attack. Key risks can cause sudden spikes in blood pressure, may trigger irregular heartbeats, arrhythmias, can interact dangerously with antidepressants, beta blockers, and blood pressure medications. A 2024 review in the Journal of Hypertension found that older adults using pseudoephedrine during respiratory illness had a significant 2.3-fold increase in stroke events compared to non-users. Protective measures. Avoid decongestants if you have hypertension or cardiovascular disease. Use saline nasal sprays or steam inhalation instead. Always check ingredient labels on cold or flu medicines. Many hide decongestants inside multi-symptom formulas. Dr. Sharon Bergquist, a geriatrician at Emory University, puts it simply. For older adults, pseudoephedrine is one of the most common hidden triggers of hypertensive crisis in stroke medication. Type 6, blood thinners and anticoagulants, warfarin, DOACs. Now this one might surprise you. Medications that prevent stroke can also cause stroke, if not carefully managed. Blood thinners like warfarin, apixaban, Eliquis, or rivaroxaban, Xarelto, are life-saving for people with atrial fibrillation or clot risk. But incorrect dosing or interactions can cause dangerous bleeding in the brain. According to Harvard Medical School and the American Heart Association, AHA, anticoagulants are responsible for nearly 15 to 20% of all intracerebral hemorrhages in older adults. AHA journals. What goes wrong? Dosing errors or skipped blood tests for warfarin users. Mixing with non-steroidal anti-inflammatory drugs, alcohol, or herbal supplements like ginkgo biloba. Age-related kidney decline that slows drug clearance. A study published in JAMA Neurology, 2023, found that improper anticoagulant management increased hemorrhagic stroke risk by nearly 3 times among adults age 70 and above. How to stay safe. Get INR levels checked regularly if on warfarin. Inform your doctor about every medication and supplement you use. Never stop or start a blood thinner on your own. As Dr. Stephen Messe of the University of Pennsylvania notes, the benefit of blood thinners outweighs the risk when monitored properly, but lack of follow-up turns life-saving medicine into a stroke trigger. Medication type 7, corticosteroids, prednisone, dexamethasone. Corticosteroids are widely prescribed for inflammation, arthritis, asthma, or autoimmune conditions, but long-term or high-dose use can raise stroke risk through several mechanisms. A major study in the BMJ 2024 showed that patients using oral corticosteroids for more than 3 months had a 2.5 times higher risk of stroke compared to non-users. BMJ. Why this happens: steroids raise blood pressure and blood sugar levels. They increase LDL, bad cholesterol, and promote weight gain. They make blood vessels more fragile and raise clotting risk. Older adults taking corticosteroids for chronic conditions like rheumatoid arthritis or COPD are particularly vulnerable. Safety tips. Never stop steroids abruptly. This can cause adrenal shock. Ask your doctor about the lowest effective dose and possible tapering schedule. Regularly monitor blood pressure, glucose, and cholesterol. Dr. Jeffrey Curtis, a rheumatologist at the University of Alabama, advises, every long-term steroid user should have a cardiovascular risk review at least once a year.